Hi, everybody. Welcome to the second half of psychopathology. Psychopathology, again, is mental illness and disorders. So, what we're going to do today is talk about different categories of mental disorders and then make sure that we can distinguish between some of the most important disorders within each of those categories. Now, to start this, though, I'm going to ask you a general question. I want to hear your opinion. I don't expect that you know the right answer right now, but I want you to answer this question. The answer to this question is actually number four, both A and B, depression and anxiety. Now, the reason why this is an important point is because suicidal ideation, that means to think about and to either desire or think about suicide a lot. That really has not increased, but depression and anxiety has. And so the question is, does that mean that more people are having depression and anxiety, or is it just that we're diagnosing depression and anxiety a lot better in college-age students? Well, the reason why we think that depression and anxiety are actually increasing within the last decade is because suicidal ideation is not increasing. That is, ideas of suicide and other forms of mental illness are really not increasing. And we would assume that if it's just a matter of diagnosis, then we would see more of the suicidal ideation as well. But we do see more depression and anxiety now than we did 10 years ago. Now, several people have a lot of different opinions about this. One opinion is that the increase of social media actually creates a lot more social comparison and people negatively affect each other, less quality interaction, etc., which actually leads to more depression and anxiety. Now, that is a theory. We don't know that that's the case, but we do know that depression and anxiety seem to be increasing. But when we talk about depression and anxiety, what exactly are we discussing? What does that really mean? Let's start with the idea of depression. If you remember, we talked about the DSM-5, and in the DSM-5, which is the handbook of different disorders that we have in psychology, it's published by the American Psychiatric Association, they have different categories of disorder, and within each category, they have several different kinds of disorders. Well, depressive disorders is one category, and that includes depression, which we mean major depression, dysthymia, as well as other things, for example, premenstrual dysphoric disorder. So, what we're going to do now, and for each of the different categories that we have, what you need to understand is what that category generally is about, and then also how to distinguish the different disorders within them. I don't expect that you know all of the different disorders that are in there. For example, in depressive disorders, there's other depressive disorders that are out there, but we're only going to talk about these three. And so I need you to be able to understand and distinguish between the different kinds of disorders within the category. So, for example, major depression is that you have depressive symptoms for 2 weeks continually, so at least 2 weeks. Now, when we're talking about depression, we're not just talking about, feeling a little bit down. We're talking about, get in the way of your life kind of feelings of lack of energy and desire to do things, negative feelings about yourself, etc. But we're talking about, get in the way of your life kind of depression. If you get dumped on a Friday and you spend a weekend eating Ben and Jerry's because you're feeling sad, that's not a diagnosable major depression. That is, I feel sad for you when that happens, but it's not a diagnosable disorder. It's a diagnosable disorder when it goes to 2 weeks. That's the major depression. Dysthymia, on the other hand, is a minimum of 2 years. Now, the difference is dysthymia, tend to be able to go about their life. That is, they're able to continue with school or with work, but they have a persistent feeling of being down, less energy, etc. That's that is harmful, but they can still function on a day-to-day basis. Whereas major depression tends to be relatively debilitating in terms of your ability to go about your life. Dysthymia is also called persistent depressive disorder. So what you need to understand is the difference between major depression, 2 weeks, intense symptoms, versus dysthymia, 2 years, less intense symptoms. That's the distinction that we're talking about. Now, the reason why I put premenstrual dysphoric disorder is because I don't know if you remember, we talked about the difference between the DSM-4 versus the DSM-5. So currently we're in the DSM-5, which means that some disorders exist now that didn't before. For example, premenstrual dysphoric disorder, which has to do with very intense feelings of depression that go along with a woman's menstrual cycle. So cyclically, they'll have these feelings of depression in concurrence with their menstrual cycle. Now, we're not talking about just having a change in mood in accordance with your menstrual cycle. That's not what I'm saying. We're talking about like a diagnosable kind of depression that goes along in the cycle of the menstrual cycle for women. Now, obviously, that's relatively rare compared to something like major depression, but I wanted to show that this is something that frankly didn't exist in the last DSM-4. We didn't have that particular diagnosis, whereas now we do. Some disorders exist now that didn't before, even though obviously women were going through that uh, previous to this new edition. So I just want you to make sure that you know that there are distinctions between when those disorders became a diagnosable disorder according to the DSM. Now let's talk about bipolar disorders. Now, the bipolar that we really care about is type 1 versus type 2. This is a good time to start talking about the distinction between ideas of bipolar, schizophrenia, and dissociative identity disorder. Sometimes people think that bipolar means multiple personalities. I've got one personality and then another personality. That's not what bipolar means. Bipolar means the two poles are depression and mania. Those are the bipolars, two poles, bipolar, depression and mania. Those are the two poles. And what that means is that people go through, in bipolar disorders, they go through periods of depression and then other periods of mania or hypomania, which we'll discuss in just a second. That's very different from dissociative identity disorder, which is when you have multiple personalities. Sometimes people also think that schizophrenia is multiple personality disorder, but it's not. People who suffer from schizophrenia do not have multiple personalities. We'll talk about schizophrenia later on. So just make sure that you know the difference. Bipolar 1 versus bipolar 2. Bipolar, both of them have this cycle of mania and depression. And specifically, that depressive part is important. And it's not a persistent depression, it goes through cycles, right? Bipolar 1, type 1, you go through full depressive states and then a full manic state. By a manic state, we're talking about a lot of energy. By a lot of energy, I mean like you can't sleep for days on end. People have people feel really exhilarated and things are often very creative, but they also do very impulsive actions, things they would not do otherwise, whether that's, they engage in whatever impulse, sometimes sexual, sometimes criminal, sometimes other kinds of impulses that they normally wouldn't. When we're talking about type 1 mania, we're talking about a kind of manic episode that can get you hospitalized because you're just going full blast and you're doing things that you really shouldn't be doing. Now, that is one pole, the mania, compared to the other pole, which is depression. Type 2 bipolar disorder has to do with a less manic phase. So hypo means less. Hypo means less. So less manic, hypomania. So someone in type 2 bipolar might still have the depression, but then they won't go to a full manic phase. They might have a less manic or a really just kind of cycle out of that depression in a hypomanic phase. Now, later on, we're going to get to the ideas of case studies. Case studies are when you talk about one individual person's experience with a bipolar disorder. So, or whatever the disorder happens to be. So a case study might include the experience of one person. So for example, Princess Leia, Carrie Fisher, the actress Carrie Fisher, has been very public about her experience before she passed away, her experience with bipolar and how she experienced the bipolar disorders. And she would even talk about how she would go through the depressive phases and how she actually enjoyed sometimes the manic phases. But the problem was that the manic phases really got in the way of her life and caused problems to her relationships and other things that were severely problematic. Bipolar disorders are certainly much more treatable now than they used to be in the past. There are good medications now for bipolar disorders, but it's often difficult because when people are in a manic phase, they feel pretty good and they don't want to really be taking their medications because they often feel really good until the aftermath of the manic phase. But when people maintain their medications, they can really control that fluctuation. The problem is that often Again, when you're going through a bipolar disorder, you're going to fluctuate between the manic and the depressive, which means that you're going to naturally go out of a depressive phase, which might mean that you feel like you should get rid of your medication. It's actually not a very good idea. So go ahead and answer this question about bipolar. The next category that we want to talk about is anxiety-related disorders. So anxiety-related disorders, so if somebody says that they are diagnosed with anxiety, normally what they're talking about is generalized anxiety disorder, or GAD, generalized anxiety disorder. According to generalized anxiety disorder, it's natural to feel some fear or trepidation, nervousness. That's pretty normal. Generalized anxiety disorder is when you feel those feelings of trepidation, problems, anxiousness without a legitimate or a cognitively obvious reason why you would experience those feelings of anxiety. And the reason why this is such a big deal is because, do you remember when we talked about misattribution of arousal? So what this is saying is sometimes you're naturally, when you have generalized anxiety disorder, your body naturally sends those signals of anxiety without an outside cause. It's just your body experiencing those things. Well, we naturally, according to Schachter and Singer's two-factor theory of emotion, we naturally search for reasons why we would be experiencing different kinds of feelings, and that includes generalized anxiety disorder. So when somebody has that, they say, "Oh, I'm feeling anxious, I'm feeling nervous." They'll look cognitively for a reason in their life why they're experiencing that. Well, the problem is that that might not be the reason. They might just be experiencing anxiety because of the disorder. The disorder is just sending that signal of anxiousness, fear, trepidation. So generalized anxiety disorder is when you start to feel those without a specific reason why you should. So for example, if you are being, if you're in the jungle, you're being chased by a tiger and you're feeling anxious about it, that's not a disorder. But if everything is going fine in your life and you're having extreme reactions of anxiety to things, when that is not, a really logical or good reason why you should, that's when we're talking about generalized anxiety disorder. Panic disorder has to do with panic attacks. Now, panic attacks are a little more extreme than just generalized anxiety. Obviously, you can experience panic attack on generalized anxiety, but a panic disorder specifically is about feelings of panic and having those panic attacks in an abnormal basis. If you experience, a few panic attacks throughout your life, that doesn't mean that you're having a panic disorder, but panic attacks that are pretty regular, that's when you have panic disorder. So panic attack is when your body does an extreme panic reaction without a good reason why, or technically with a good reason why. But a panic disorder, you'd be having those without a good reason why. So your body will close in. You'll feel really anxious about people being near you. You might hyperventilate. Hyperventilate means hyper, too much ventilation, too much oxygen. The reason why people breathe into a bag when they're doing this is to help regulate the oxygen in your bloodstream. If you have too much oxygen in your bloodstream, that can be bad for you. So when they breathe in a bag, they're trying to get more carbon dioxide into their system to help regulate the mood, to help regulate the oxygen, so that you can function more normally. Phobias are specific. So you have specific phobias to specific things. So whether that's, heights or whatever happens to be, it can be anything. Some people have phobias for very, very different reason. Now, phobias doesn't mean that you're generally, I don't like them. It means that you have more of almost a panic attack kind of an experience in related to these things. Now, again, if you start to feel kind of panicked because a tiger is about to jump on you, that doesn't necessarily mean you have a phobia. We're talking generally about things that shouldn't cause that extreme of a reaction. Social anxiety is a anxiety related disorder, and that is extreme anxiety, feelings of trepidation in regard to social situations. Not just public speaking, but social interactions in general. It's not just being shy, it's pretty extreme, like can't function kind of social anxiety. And even thinking about it can cause these kinds of feelings. So it's more extreme than just being shy. It's a diagnosable disorder. Agoraphobia, the agora, traditionally in Greece, was the city square, right? So some people think that agoraphobia is the fear of outdoors or large spaces. But what it is the fear of not being able to not being able to escape from those kinds of spaces. So often agoraphobia is experienced by, hey, I might have an anxiety or panic attack, and I don't have a way to escape or get away where other people won't be able to see me have this. And that leads people to not want to go out in public, but it has more to do with the idea of not being able to escape in case there is an idea of a panic attack or an extreme anxiety attack. You can't get away. And that often leads people to not want to leave their house. Go ahead and answer this question. Feeding and eating disorders. There's several different feeding and eating disorders. We mentioned these before, but let's go make sure that we can distinguish between anorexia and bulimia. Now, just so you know, anorexia and bulimia are really not very common kinds of disorders overall, but it tends to be that in college age groups, specifically in the United States, college aged women, these things tend to be more common than they do in other parts of the population. Now, that being said, I'm not saying that anorexia or bulimia can't affect other people, because they do. They affect adults who are outside of college. They affect teenagers and even younger. But it does seem to be more of an issue, or at least more talked about or visible in college age populations. And while it is more common of a diagnosis in women than it is in men, it doesn't mean that men don't have eating disorders. They do. I have a friend who I know who is male, who had an eating disorder, for example. So they do happen. Anorexia has to do with unhealthy body weight. So it's not just that you're so worried about it, etc., but you're worried about your weight and you fixate on the weight so much that you lead yourself to an unhealthy body weight. And people who suffer from anorexia don't realize that their body weight is unhealthy. There's a specific body mass index that will indicate when you are in that space, and that's actually in the DSM. So for somebody to be diagnosed with anorexia, they have to be experiencing, a constant worry about their image and their body image, to the point where they get their own body mass index to an unhealthy level, too low, and they don't realize that it's becoming too low. And again, this is not due to other medical conditions, right? So we're not saying that you're experiencing anorexia in case you have some sort of disease which makes you lose weight. That's not what we're talking about. We're talking about people making themselves lose weight based off their body image and an unhealthy habits. Anorexia can include binging and purging, right? Binging means eating a lot. Purging means getting rid of it. So purging often includes vomiting, but you can purge in other ways. So for example, sometimes people who purge use too many laxatives, or maybe they will try and over exercise to purge whatever they've been doing. Anorexia, you can do those, but anorexia is specifically involved in having an unhealthy body mass index that is unhealthy, too low. Bulimia, on the other hand, does have to do with binging and purging behavior, but you don't go into an unhealthy body mass index. So people who suffer from bulimia nervosa will often maintain a healthy body weight, but they are concerned about their body image, and they often go through purging behaviors to try and get rid of calories in order to try and maintain a body image. That being said, they can often do this while maintaining a healthy body mass index, at least. I'm not saying that bulimia is healthy. That's not what I'm saying. I'm saying their body mass index doesn't get low enough to be called anorexia. Post-traumatic stress disorders become a lot more visible since the wars in Iraq and Afghanistan and other places in the Middle East. Post-traumatic stress disorder has to do first with trauma. Trauma does not mean something embarrassing happened to you. That's not what we're talking about. When we talk about trauma, we're talking about somebody getting close to death, or seeing somebody get close to death or dying, that kind of a trauma. I mean, we're talking about pretty strong trauma. Sometimes that does include things like sexual abuse, etc., but we're talking about a specific trauma. Now, let's just say that you were out on a date and you went to the bathroom and you came back and there was toilet paper, tucked in your shoe and everybody laughed at you. Well, that's embarrassing and I'm sad for you, but that's not trauma, right? It's not what we're talking about here. We're talking about that kind of close to death kind of an experience. Problem with post-traumatic stress disorder, it often includes intrusive thoughts. Intrusion has to do with the idea of intrusive thoughts. So for example, a soldier who um, may have seen a Humvee in front of them explode and they saw one of their friends die. The intrusive thoughts would be the thoughts of that experience happening over and over again, right? That experience. Avoidant means that people might avoid situations or people that remind them of the events because that's just too difficult to deal with. Negative alterations have to do with alterations to your behaviors that can be problematic, including getting away from life, but also including doing things to try and protect yourself from those behaviors which are not healthy. Arousal has to do with the physical arousal that can happen when those intrusive thoughts come to you. Now, these intrusive thoughts, they're intrusive. We're not talking about, oh, you're thinking about something you don't want to think about. We're talking about intrusive thoughts that really, really harm and get in the way of your life. And these are very problematic and can have persistent results. Post-traumatic stress disorder, though, we are treating it much better now than we have in the past, and allowing people to get the treatment that they need to take care of, a very serious problem that does happen, not only in soldiers but also in people who experience other forms of trauma. Let's talk about OCD and related disorders. OCD stands for obsessive compulsive disorder. Obsessive compulsive disorder is different, though, than the way that people talk about OCD just in general. OCD has to do with an obsession, normally involved with like an anxiety of some form, right? An obsession. I'm obsessed with something bad happening. And that leads to a compulsion, which is behavior. So, for example, somebody might be obsessed um, with the idea of getting sick. Okay, so they're constantly worried about getting sick, but not in an unhealthy way, like constantly worried about the germs, and that might lead to compulsions, which would be almost you should think about these in terms of um, like superstitious kind of rituals that they might do. So not just washing your hands, but washing your hands a specific amount of time, or washing your hands a specific amount of time while you look in a specific direction, or washing your hands a specific amount of time and you have to turn off and on the sink a specific amount of time. That's what we're talking about with obsessive compulsive disorder. Somebody who just wants everything to be neat and tidy, etc., they probably don't have OCD. They might have a different disorder called OCPD, obsessive compulsive personality disorder, which actually is not in this category, but has to do with really needing things to be in a specific ordered way in an unhealthy manner, so in the way that it gets in their life. So the cognitions are the thoughts about the obsessive part, right? It's the thoughts about what might cause the anxiety. The behaviors are the compulsions. Under OCD and related disorders, we also include hoarding disorders. Hoarding disorders are when people refuse to give away things. They constantly collect. They're so worried about getting rid of something because of the anxiety that it causes. That is different than just being messy. We're talking about not getting rid of garbage and other things, and it gets in the way of your life. Body dysmorphic disorder is a little bit different. Body dysmorphic disorder is when somebody has a fixation, I shouldn't say fixation, they think constantly about one of their physical attributes. So sometimes it's the shape of your nose, or maybe it's a mole, or maybe it's the shape of something about your body, right? To the point that they think about it way too much, and they think that people are judging them about that one particular body part to an extreme amount in an unhealthy way. That's what we're talking about when we're talking about body dysmorphic disorder. It is not just, hey, I want to kind of improve my body weight. It is, hey, constantly thinking that everybody is looking at my nose and judging me about my nose, and my nose is constantly, being judged and ridiculed, and it's ugly, that kind of a thing. Schizophrenia. Schizophrenia is based off the idea of unorganized, disorganized thoughts. So These YouTube videos that I have the links to are about Gerald, who has a very specific kind of, not a specific kind, but a good example of schizophrenia. These are unorganized thoughts. Now, normally when we talk about schizophrenia, we think about hallucinations, and hallucinations do happen under schizophrenia. In fact, auditory hallucinations are the most common form of hallucination. Visual hallucinations are actually relatively uncommon when we talk about schizophrenia. But other things can happen besides hallucinations. Positive and negative symptoms, this is much like when we talked about positive and negative reinforcement, right? Positive means adding, negative means taking away. So a hallucination would be a positive symptom. We're adding something that normally shouldn't be there. A negative symptom might be blunted affect. Affect means your feeling state. So blunted affect means you can't experience emotions in a normal way. People with schizophrenia often have other things as well, including paranoia, but also delusions of grandeur. Delusions of grandeur include thinking that you are better than you are, whether that's like royalty or you have a high status job or position. Sometimes you think that you are God or or you have superpowers, that kind of a thing. Word salad is that because of the disorganization in thought, people sometimes will jumble sentences and experiences so that what they're talking about is a word salad. It doesn't make sense. It's not a logical flow of thought. It's a jumble, convoluted jumble. Go ahead and answer these questions and we will be done.